Hello, it's Dr. Rhonda Johnson. Today is Monday, October 24th, 2022, and today I'm discussing COVID-19 data. Well, you know, health experts don't always agree when it comes to COVID, but when it comes to COVID data, experts seem to agree on one thing. COVID case numbers data is unreliable. So why do I say that? Because according to some experts, the true number of cases, folks, may be up to 20 times higher than what's being reported now. Why is that? One, PCR tests are harder to access. Most home rapid test results are not reported anywhere. Sometimes people aren't even bothering to test, even if symptomatic. They're going to attribute their symptoms to a cold or to an allergy or to, quote, sinus infection. There's lots of reasons. You know, this is fall season. And there's a lot of COVID denial out there. You know, people think it's over with, it's behind us, and, you know, get on with it. Also, state and local health departments and the CDC are no longer reporting on daily cases, just weekly for the most part. And the funding for COVID-related public health infrastructure has dwindled. So the bottom line, folks, if you hear on your local source of news that the number of cases being reported, just assume it's inaccurate. So what COVID data is reliable? Well, wastewater surveillance data is reliable. You all know the virus gets excreted in our stool and in our urine and ends up in sewage. And levels that rise and fall can predict a surge as well as a decline in community infections. Wastewater can also be tested to see which variants are circulating in a community. The sad thing is not all states and localities have adequate wastewater testing and surveillance. For example, rural areas are much less likely to have adequate capacity than some big city areas. Now, one other source of data that's reliable is hospitalization data, because hospitals have to report this to the federal government. The problem is, in terms of forecasting, hospitalization can lag behind actual cases in a community by 2 weeks just due to the nature of the illness. So folks, is this acceptable? In my opinion, absolutely not. No COVID data, no COVID problem, right? Is that where we're heading? I certainly hope not. I personally think this country should and has the ability to have the best public health data reporting systems in the world, not just for COVID-19, but for any and all other infectious diseases. And folks, I think we need to demand funding for public health and hold our elected officials accountable. So as you look to Election Day, look at the voting records of your candidates to see how they have been voted on important health issues at the local, state, and federal levels. That's my message today. My views are my own. Be well and take care.